Thank you, thank you, thank you. And I want to thank everyone who is participating today. A big thanks to Carrie Peppermint and to Eli for giving Bob and me this opportunity to talk with you about the healthcare reform needed in the United States. It is terrific that the Michigan Democratic Party adopted Medicare for All as part of the party platform in September 2020. Clearly, the Democratic Party here knows the healthcare crisis in our country, and the best solution for the future is a single payer system, as described in the Medicare for All bills. There may be folks today who would like some talking points to share this message with family and friends, neighbors and colleagues. And for that reason, our program is divided into two parts. The first 5 minutes, I will point out several critical issues facing the United States healthcare system, and I will also do a brief review of Medicare for All. Bob will take up the discussion, turning to what steps we can do now, and following our remarks, we hope to hear from you with questions, comments, and suggestions about how to spread the word. Eli, slide 2, please. Some of the slides I will show you are from PNHP, which stands for Physicians for a National Health Program. PNHP has over 20,000 members. It began in 1987 for the sole purpose of passing a universal comprehensive single-payer national health program. The PNHP website is one of the richest sources of information on the crisis in healthcare in the United States and the best solution. I encourage you to check it out. You'll also see on the screen the names of two more important organizations, Healthcare Now and Michigan for Single Payer Healthcare. Both of these have good information and resources. Slide 3, please, Eli. As reported, the urgency and the absurdity of our current healthcare system is demonstrated in the case of Shirley Perry. As reported by Kaiser Health News, Shirley Perry was a registered nurse working at the UVA. She became chronically ill. She lost her UVA job and her insurance. She needed medical care. She was sued for more than $218,000 plus $32,000 in legal fees. Sadly, she died at age 51. Yes, this is a tragic, powerful example. Sadly, it is not uncommon. I am sure you know of family and friends who are frightened about getting sick and the bills they potentially will face. Keep this in mind as we go on. The urgency and equitable access to healthcare in the United States has never been more evident than it is now. Long-standing differences in access to healthcare have intensified during our COVID-19 pandemic. One study published in March 2021 estimates that about a third of the COVID-19 deaths and 40% of the infections were tied to lack of insurance. A majority of Americans hospitalized for COVID-19 were and still are people of color, including 33% who are Black. Nationally, Black Americans are more than twice as likely to die from COVID-19 as whites. In Michigan, the death rates for Blacks is 6 times higher than for whites. The reasons for the higher rates of COVID-19 infections and deaths for Black people, according to studies, include lack of insurance, lack of access to primary care, and employment with high risks of exposure to COVID-19. Let's step back for a moment and look at the picture of healthcare in the United States before COVID-19. It has been documented for decades that the United States has exceptionally high healthcare costs and poor population health outcomes compared to other high-income countries. Many of the reports, like that of the Commonwealth Fund published in 2019, look at data from the OECD. OECD stands for the Organization for Economic Cooperation and Development and includes 10 high-income countries. In 2016, the United States spent about 18% of gross domestic product on healthcare. while other countries in the study spent as low as 10% for Australia and as high as 12% for Switzerland. Life expectancy in the United States, however, was the lowest of all the 11 countries in the study at 78.8 years. The range from the other countries was 80.7 years to 83.9 years. And as compared to the other 10 nations, which spends less on of their economy on healthcare, the United States has the highest suicide rate, the highest chronic disease burden, an obesity rate that is 2 times higher than the OECD average, higher mortality for mothers and higher infant mortality than all the other OECD nations. And what is extremely important is that 8 of the 11 OECD countries have health insurance in some version of a public, nationally administered single-payer system. Everyone has access to healthcare and it is publicly funded. In the 2 countries without a single-payer system in the comparative study, Switzerland and the Netherlands, health insurance is mandatory for all residents, but it is privately paid for. In the United States, we have a patchwork of public and private health insurance. And sadly, even with all the private insurance and all the public programs in the United States, we still have an estimated 30 million Americans without health insurance and 41 million that are underinsured. May I have the next slide, please? Slide 4. For all of these reasons, thank you, and many others, let's talk about Medicare for All, a national single-payer insurance program, and make sure that we know what it means. Medicare for All would give us one quality plan that would provide all necessary medical, preventive, dental, hearing, vision, behavioral, physical therapies, etc. With Medicare for All, health insurance would be publicly administered. It would operate like our current Medicare system, which has covered healthcare costs for people over 65 and with certain disabilities for over 57 years. Medicare is one of the most favored government programs in the United States. In Medicare for All, most physicians would be in private practice as they are now, and you would have your choice of healthcare provider. Slide 5, please. Currently, the Centers for Medicare and Medicaid Services in the United States is the single largest payer for healthcare in the United States. And as you see in this slide, which I apologize is dated, public health insurance programs covered almost 65% of the healthcare cost back in 2013, and it has only been growing. So please be disavowed of the idea that most people in the United States are covered with private health insurance. Medicare operates efficiently and effectively, paying 97 cents of every dollar on direct healthcare services. Medicare is a tested and proven United States model. Now, notwithstanding the many positive benefits of Medicare, for those of us who are beneficiaries, moi included, we know Medicare needs to be improved, and Bob will talk about these concerns. May I have the next slide, please? I hope this brief review answers some of your questions about Medicare for All. And if not, again, please raise them after Bob's presentation. I will leave you with this last slide, again, a P&HP slide as recorded by the Kaiser Family Foundation. It's a healthcare poll. It shows growing support for single payer. Note the cutoff date is 2017, and single payer now in many polls is currently showing an 88% approval rate among Democrats, even 46% among Republicans. I'm going to stop right here. Thank you so very much. And now I'll turn it over to Bob.
Okay, thank you, Jackie. Can we get next slide, please, Eli?
Sure, let me see if this can work.
The number 7, yes. Thank you. Thank you, Eli. This is my cat, Spooner. My wife and I adopted him about 5 years ago. And oddly enough, whenever we go and leave the house for more than, say, 8 hours or so, I like to ask a neighbor to come and check in on Spooner because I'm concerned about his well-being and I want him to be happy. And a lot of times when I tell people this, they look at me kind of strange and go, well, he's a cat. He'll survive. And quite often I will not respond to that comment because it's, somewhat accurate, but in my head, I'm thinking it's not a matter of survival. I want my cat to thrive. And that's one of the reasons why I look at Medicare for All as an opportunity, not just to fix healthcare problems, but also for we as a nation, as a community, and as a family to thrive. And not just in terms of recipients of healthcare, but also ourselves. One of my spiritual beliefs is that we diminish ourselves when we look at our neighbor and our sisters and brothers and say, well, we really don't need to be concerned about their well-being. They're going to survive. That is truly a way of diminishing us as human beings and diminishes us as a family and as a nation. Can you go to the next slide, please?
Certainly.
So the status of Medicare for All legislation right now, we mentioned already, and we all know about the Bernie Sanders bill that's not yet been introduced this year. He's waiting until after the reconciliation process for reasons I'll get into a little bit later. But we also have Yusuf Rabi. I think he's still on the call. We have his bill in Michigan looking to be reintroduced this year. And the one that's most exciting is the House Resolution 1384 presented by our Representative Debbie Dingell and Pramila Jayapal. We are now at a high watermark of co-sponsors of 118, and we're looking for another 100 Democrats specifically to co-sponsor this legislation and get it through to the House. This may or may not happen this year. We're playing the long game. We're focusing on Democrats, but one of my delusions perhaps is that eventually we're going to get Republicans to support it. Can we go to the next slide, please? We're here today specifically because I'm really excited, and I think everyone should be excited about the reconciliation bill. As Debbie Dingell mentioned, and almost as Commissioner Schink, I felt like you're presenting a reconciliation bill for Washtenaw County. It was gorgeous. This reconciliation bill that we're working on, the $3.5 trillion package, is incredibly exciting. And I like to look at it as we have a plan and we're on the road to Medicare for All via this reconciliation bill. When you look at what's in the reconciliation bill, the items that are asterisked on this slide are part of Medicare for All. So we're looking at expanding Medicare coverage to include dental, vision, and hearing. Incredibly exciting, and a strong possibility that this might happen. We're looking at lowering Medicare eligibility age, either to 55 or to 60. Lower probability event, but still a possibility, and it's always good to be talking about those things. Another high probability thing, because we know it's got widespread support, is allowing Medicare to negotiate lower prescription drug pricing. I recently found out that even the let's say less than beloved Joe Manchin actually supports this provision. We also have expanding long-term care benefits for home and community-based services. Again, part of Medicare for All. In the reconciliation package, we also have expanding Medicaid coverage to the states that refuse the ACA. Again, as far as I'm concerned, this is another move towards Medicare for All. And also, again, enhancing the ACA subsidies. I believe this would be expanding them and extending them for the 10 years of the reconciliation bill. So this is that $3.5 trillion package that we all should be advocating for so strongly. Can we go to the next slide, please, Eli? So what we're asking people to do right now, and when you get a chance, whenever you get a chance, until we can get a resolution on this reconciliation bill, is please call, write, tweet at your representatives and our 2 senators, especially. And what I would like to very specifically ask people to do is, while you're advocating for these healthcare measures in the reconciliation bill, remind them that Medicare for All is the ultimate destination. We're on the road towards Medicare for All, and we want to stay on that road. I'm willing to stay at various stops along that road, but we got to get to the ultimate destination. And this reconciliation bill is a wonderful, wonderful vehicle for getting us that much closer. Also, please share your story with friends and neighbors and coworkers. Don't be shy about complaining about health insurance. Don't be shy about telling if your family is having trouble paying medical bills or understanding medical bills. Connect with local and national groups, the ones that Jackie mentioned. There's also a wonderful organization called National Nurses United. They're going to be doing a postcard writing campaign in October, and they're also going to be focusing again on 5 representatives around the country, one of them being in Ohio, that we want to focus on to get us that much closer to getting it through the House. Again, this is a long ground game. We're going to grind away at these people. We're going to keep reminding them that Medicare for all is the most important process, is the end goal in healthcare reform in this country. We also invite you to invite us to come speak with your group. If you have a group that's a church affiliation, another political affiliation, and you think they'd be interested in hearing more about Medicare for all and the exciting possibilities of Medicare for all, and also just the great exciting challenges, that the opportunities that are there via Medicare for all. I always welcome and love the hard questions about Medicare for all. And I also want to leave you with the thought that, people ask, well, why now? Why would you be talking about Medicare for all? I mean, the campaign's over. We have a president who said he might veto it. Well, guess what? This reconciliation bill is strongly being sponsored by Joe Biden. So I suspect that he knows that this is getting us closer to what progressives and what we all want. And he knows that popular opinion does support Medicare for all. So there is an opening. And I truly believe that rather than things having to get worse before we make them better, I think positive change happens when we sense that there's hope in the air. Can we get the next slide, please, Eli? So we welcome your questions. I also want to mention just one very specific thing that I think that Debbie Dingell touched upon very importantly. Just as the first question, again, why focus on Medicare for all? I mean, there's so many priorities out there. There's climate change, and there's poverty, and all these other issues that are dividing our country. And the reason why I'm such a strong advocate for Medicare for all is because, yes, we face all of these tremendous challenges, but Medicare for all, to me, is the way that we become a we to face those challenges. Again, if we seek to thrive together and prosper together, we can address the other challenges better. If we have a sense that we are a family, that we care about each other, we will be able to face these challenges and meet those challenges. So we welcome your questions. Thank you.
Thank you. So those who would like to ask a question, I ask you please to use the raised hand function. And I will call on you. Let me just see if there are any questions in the chat. I prefer the raised hand function. Let's see, I don't see any. Rodney Curtis, I'm going to allow you to talk. Okay, you are unmuted.
Can you guys hear me? Can you hear me okay?
Yes, we can.
Great, good. Great presentation, everybody. To me, the most compelling issue is that $300 million a day spent in Afghanistan. How do we get that amount diverted for like a week and into the coffers for Medicare for all?
I can feel that question. I feel like it's an incredibly important question because it speaks to the conversation that we need to be having about our priorities. Again, that $300 million figure that just stunned me when Joe Biden mentioned it, it speaks volumes as to what our priorities here. We have a vast institutional structure of violence that we practice and we use in our nation. And what advocates for Medicare for all are seeking is an institutional structure of compassion and empathy and love. And so it really is, it needs to be a family conversation about what our priorities are. And for me, the priority is always that we care about each other and we take care of each other. Everything else kind of falls by the wayside. And if we don't prioritize our relationship to one another, politics isn't even relevant, because politics is strictly about prioritizing and looking at the value of relationships. I hope that answered the question.
Yes, thank you very much.
Jackie, do you have anything you want to add to that?
No, I'll let you go on. Good answer, Bob. Thank you.
All right, so the next person with their hand up is identified as Washtenaw County Democratic Party. Frankly, that applies to a lot of people in the room, but I'm going to allow you to talk, whoever that is, and you need to unmute yourself.
Oh, it's Janet. I guess I'm still signed into the webinar as I'm using it the other day. So yeah, my question is, and this actually is the same question in a lot of areas that we're all trying to work toward. It's well known that people who enjoy a certain advantage, in particular the opportunity to make a ton of money, are not very amenable to letting go of that advantage and that source of more and more numbers on their balance sheet, which after a certain point is all it amounts to, in my opinion. But we have an actual strategy to counter the inevitable big pushback from those in the insurance companies. Do we have a sort of on the ground strategy too for proposing how all the people who are employed in those areas would then be able to transition into being useful in the new system, sort of to undercut the grassroots opposition? But in particular, you know, how can we fend off the people who are already in that position of power and are not going to let go of it easily?
I'll start that answer. Thank you. It's a terrific question. First, a point of fact is that in the Medicare for All bill, there is explicit language about how folks who have lost their employment, particularly in the insurance industries, but in other areas, would be eligible for 5 years, I think it is, of retraining and support for employment. The best ideas and estimates are that when Medicare for All gets passed, we have the opportunity to build out the infrastructure of healthcare needs that we desperately need. So there's so many areas of the country where there really aren't good healthcare facilities. And in all of these ways, and many times even here in the heavily medicine in filled Ann Arbor area, there are long waiting lines for tests and for various appointments. With the Medicare for All introduction, folks who are now just in billing for insurance companies would hopefully be retrained and be able to facilitate doing more meaningful work and in the healthcare service industry. So that's a vital part, and it's in the bills. Another part of your question was about how to offset the vested interest of the insurance companies, who, you're absolutely right. The moment that the insurance companies smelled that Vermont was going to go for single payer, they started running the famous ads about the deaf panels and all this type of nonsense. The fact of the matter is that for the insurance companies, I think they're getting scared. Charlie Munger, those of you who are familiar with Berkshire Hathaway, this is a guy who handles billions and got billions of dollars of money. Charlie Munger has been on record in Forbes magazine and various other places saying single payer is a no-brainer. The rest of the industrialized wealthy countries in the world are eating our lunch. They don't have to pay $5,000 of healthcare benefits into every car. And to even many of the major corporations in the United States are coming around to this idea. So this is a critical moment, as folks have been saying, that when we're talking about 88% of Democrats and even 46% of Republicans realizing this health insurance, it's killing me. It's for a family of four, $833 a month as on average. It is the weight of our combined voices. That's why we say spread the news, spread the message that will eventually overtake these corporate vested interests.
Thank you so much. We've now reached 11:15, and so we have to move on to the next segment of our program.
Thank you all.
Thank you so much, Bob and Jackie. Really appreciate it.
Thank you.